Next, from the state of Wisconsin, Families and Schools Together, David Frazier and Lynn McDonald.
In Wisconsin and all of your states, we are worried about our kids getting into big trouble. The headlines every day say alcohol, drugs, delinquency, school dropout. And our question is, can we prevent this by starting early? FAST is a prevention program where teachers target 4 to 9-year-olds. Teams actively recruit whole families into family involvement in the program, and not-for-profits work with schools, mental health and alcohol and other drug, and the parents as partners. They gather together for 8 weeks, and there's 2 years of follow-up. The New York Times on May 22nd said FAST is radically different as a prevention program. Why? Because FAST recognizes that the whole family is the source of change. It takes play therapy techniques, family therapy techniques, social networking techniques, and builds bonds on multiple levels and supports the parent to be the primary prevention agent. I wanted a consumer voice to be here today to tell you what she thought in 1 minute about FAST. She said this: FAST gave me back my son. If it had not been for FAST, my 8-year-old would still be driving me and the teacher crazy and going to the principal's office 3 times a week. Now, because I spend 15 minutes a day playing with him, he seems like a different child. He's doing great in school, he listens to me, he laughs with me, and he doesn't hit his baby sister anymore. And FAST helped me too. FAST taught me that I wasn't the only single mom who was stressed out. I was pretty much of a couch potato, and now I've made new friends for myself, and they support me in going back to school. I would trust FAST with my life, so tell them that in Boston. I hope you'll remember 2 things about this program. One is that it's research-based, and the other is that we use outcome evaluations. I was a university professor at University of Wisconsin, a state-funded university, for 12 years, and wondered why it was that the wonderful research studies that were being done by professors were not getting into practice. When I moved into the community, I actively took experimental studies that had been funded for decades by federal dollars and packaged them and translated them and put them into the FAST program and made them accessible to practitioners and to parents. For example, we spend 15 minutes a day in this program where the parent has focused positive attention with their child. That's based on University of Washington, Dr. Kate Kogan's research, over 12 years of published research. We spend 15 minutes where husbands and wives or 2 single parents talk to each other about anything they want. That's based on Harvard's research by Dr. Deborah Bell. We spend 45 minutes where the parents gather together just talking about common concerns. That's based on Robert Waller's research that showed that single parents learning parenting skills forget them all if they go back to social isolation. We spend an hour each session with the whole family as a unit sitting at a table, and they do family communication exercises that are a lot of fun. That's based on Frank Alexander's research at University of Utah. The second thing is we evaluate. Social workers do good, and then we forget to evaluate. So this is different. We use standardized forms. We use reliable and valid standard instruments that have been published on child and family outcomes. And we have data from over 50 replication sites in the Dairylands of Wisconsin and in Milwaukee, in New Orleans, Florida, and Sacramento.
I'd like to give 2 very brief final perspectives on the program. We meet with policymakers at all different levels, and we're surprised by the number of different things they say about what this program is, and I want to share a few of them with you. The mayor of Madison, who goes around to many community meetings throughout the community, says this is a community leadership development program. The state of Wisconsin developed it as an alcohol and drug prevention initiative. In California, Governor Wilson has included it as part of his anti-crime bill. Indeed, supporting families is a very positive kind of public policy approach which has many different implications. Secondly, I think it's important to recognize this as a bottom-up collaboration. We put tools in the hands of teachers, practitioners in the social work area, and parents, which they can use to change systems and to change the way their lives work. And they can quit delivering services solely on the basis of what they do within their system and focus in the same way as that mother who said, FAST gave me back my family. Thank you.
Start the questions with Ellen.
I did actually take from reading your application both that it was research-based and outcome, had outcome evaluations, and I do see those as strengths. The question I have is whether focusing on conduct in school as a trigger for this puts you at risk for focusing more on boys than for girls.
It definitely does. We have 65% of the boys referred versus 35% of the girls. And when we compare our instrument profiles of the kids, which are 2 standard deviations above the norm on all these issues, the girls are actually worse, but they don't get picked up.
So what is it you propose to do about that?
Tell people so that the teachers will change their observational techniques. You know, we totally give the referral process to the teachers. We try to answer their needs.
I'd like to follow that. Have you considered a rather than telling the teachers, have you considered a training component specifically on that issue? Because that's so key to a lot of other things that are going on, particularly in elementary education.
I think that's a good question. However, we're trying to get a collaboration working, and we find that having the school control who they refer is very important to the buy-in in different parts of the country. So each teacher and school gets to decide totally who they want to identify. Some places they've done kids with low reading scores. Some places they've done all kindergartners who are transferring into public school. The school gets to define. Now, this is in 90 school districts in Wisconsin. It was an initiative in 1990.
I think if I could follow up on that just a little bit, what Lynn is saying is very true of the first year or two that we're within a school. And then oftentimes after you've been there a couple of years, you have enough collaborative relationship that you can begin to say, well, what do we really need to focus on? What areas are we missing in your school? We've had out of that process specialized programs developed for Hmong families, for example, within one particular school district, where obviously those families couldn't participate in the program that was developed in English. So that as the dialogue progresses, you can open up the referral base.
Antonia.
Are you having any growing pains, any trouble in, as the program matures?
I think we're managing them all right. I mean, it has grown incredibly, that it's now in 14 states. So I think there are growing pains. And I think they're doing all right. I mean, we have moved into, in the statewide dissemination, the structure is very solid. There, in terms of grants applications, how each school district applies for money, there are always 2 times as many applicants as one. The training structure is very careful. You want to be more specific?
Well, give me an example of one of your biggest growing pains and how you've dealt with them.
Well, I think in some ways probably the biggest challenge to us was when we started out just in the city of Madison. We moved to statewide very quickly. I mean, we were within a year and a half. It was a state initiative. And our real need was then to break off a training arm that could begin to develop kind of a laboratory to train new people to do this in a wide variety of other settings. I mean, all the way from Milwaukee with a very inner city urban settings to rural districts in Wisconsin. And what we did in that area, just to kind of give you a little sense of it, is that we really did break off a somewhat separate staff that could take that on. That staff still had contact with practitioners, but there needed to be people that could spend their focused energy really on that replication effort. So that was a major challenge for us. We tried for a while to do it with staff going in both directions, but given the travel and other kinds of demands, it was pretty impossible for us to do that.
The last question from Harriet.
I'm just curious, do you have, I know it's a different kind of program, but I'm interested in how they interrelate in prevention, something like the Parents as Teachers program or an early intervention program like that in your area?
Well, the program is in many different places, and it interrelates well with other programs, so that the 0 to 3 parent teachers program can refer into the 4 to 9-year-old FAST program. Is that what you mean?
Well, I meant because you seem to be relying on picking up patterns in the school, but there's still the idea of getting into the home.
We go into the home on home visits, and then we bring the families together to the school. Many families.
So
there.
at this point, there is no direct